Hello, my name is Brenda, and this is my presentation on the population level health education intervention for the Tenderloin neighborhood in San Francisco, California. The four key public health concerns that I chose for the Tenderloin neighborhood in San Francisco, where I'm supposed to conduct my teaching, are high blood pressure, diabetes, substance abuse, and homelessness. Background and significance of high blood pressure, diabetes, substance abuse, and homelessness. In the United States, 1 in 3 adults has high blood pressure, and most people are not aware of it. Because there are no symptoms associated with high blood pressure, it is often called the silent killer. High blood pressure is the #1 modifier risk factors for stroke. In addition to stroke, high blood pressure also contributes to heart attacks, heart failure, kidney failure, and atherosclerosis. The higher the blood pressure is, the greater the risk of heart attack, heart failure, stroke, and kidney disease. In 2016, 27% of adults in San Francisco were told they have high blood pressure. Diabetes. In the United States, more than 25 million people have diabetes, including both diagnosed and undiagnosed cases. This disease can give way to other very serious issues and can have a harmful effect on most of the organs of the body. It is responsible for most end-stage renal disease, non-traumatic lower extremity amputation, and it is also the leading cause of blindness among working-age adults. People with diabetes are also at an increased risk for ischemic heart disease, neuropathy, and stroke. In 2016, 7% of adults in San Francisco were diagnosed with diabetes. Women who are pregnant or have gestational diabetes were not counted in these statistics. Substance abuse. Drug abuse and its consequences are among society's most prevalent health and social concerns. Causes of drug-induced deaths include dependent and non-dependent use of drugs, both legal and illegal use. This also includes alcohol abuse. People that are addicted usually engage in self-destructive and criminal behavior, which can result in injury or death. In 2016, the drug and alcohol abuse rate was 19% per 100,000 people in San Francisco. Homelessness. The federal definition for homelessness includes those individuals and families living in supervised shelters or private places not designed for regular sleeping accommodations, such as cars, parks, abandoned buildings, buses, or train stations, also airports or camping grounds. In 2017, the number of homeless individuals counted were 3,840. Objectives Healthy People 2020. The objectives for Healthy People 2020 are to improve cardiovascular health and quality of life through prevention, detection, and treatment of risk factors for heart attack and stroke. The risk factors are high blood pressure, high cholesterol, cigarette smoking, diabetes, unhealthy diet, physical inactivity, and obesity. Another goal is to reduce the diabetes rate and improve the quality of life for all the persons who have or are at risk for having it. The Healthy People 2020 National Health Target is to reduce the drug-induced death rate of 11.3 deaths per 100,000 population. Needs assessment. The following needs were observed during the windshield assessment for the neighborhood of the Tenderloin in San Francisco. There was a lack of fresh grocery stores or local farmers market. Instead, there were several liquor stores or corner stores. There were several fast food chains. There was not enough safe recreational areas or parks available. And there was lack of resources such as shelters. There was a high rate of homeless people sleeping in the street. I used the proceed theoretical framework to guide my project. During phases 1 to 4, demographic data was collected using city statistics and interviews with stakeholders to determine community needs. I identify barriers and I determine factors that influence behavior and lifestyle. During phases 5 and 8, I prepared teaching visuals and flyers for the teaching plan. I presented the education to the targeted audience. I evaluated the outcomes and developed expected outcomes for the intervention. Some of the issues I encountered were the participant receptivity, because when a person has to worry about how to make ends meet, it can be very difficult to be open to change, especially a behavior or the way you live. Also, there was accessibility to resources. There was lack of financial resources or access to clinics, shelters, or food banks. Lack of knowledge and ability to prioritize needs. Also the participant literacy level and language barriers, and also lack of access to healthcare. There were some clinics, but sometimes if you don't have health insurance, it's pretty difficult to get seen. Budget and logistics. The budget included the location. I did it in the Larkin Public Library, and that was free. I provided healthy snacks, coffee, tea, and water. That was about $40. I printed the hypertension and diabetes pamphlets. That was $23. I printed a list for the participants so that they could have a list of the community resources. That was $3. And I borrowed a machine, a blood pressure machine and a glucometer, so I didn't have to spend money there. As far as logistics, the library provided free chairs, tables, and projector for the presentation. The facility was handicap accessible and the restrooms were accessible for participants. Project evaluation. The workshops were scheduled from 1 to 4. A total of 12 people came in. 6 participants had their blood pressure taken, and the use of glucometer was shown to 2 participants. Out of the 12 participants, 6 people verbalized understanding and were able to give examples of lifestyle modifiers to prevent complications. The same people expressed understanding about the signs and symptoms of hypo and hyperglycemia and hypertension. 4 participants were able to give examples of DASH diet for the hypertension and carb control diet for diabetes. Follow-up within the community would be on the particular individual to reach out to the resources provided that day. My email was given in case participants had more questions. Results and conclusions. Determining the needs of the community was very important, and surprisingly, the stakeholders were very helpful by providing their input. The Tenderloin area in San Francisco has several needs, and all of them are very important. There was homelessness, poor nutrition, substance abuse, crime and violence, chronic illness, infectious diseases, and more. It was difficult to choose only 2 interventions due to the time restrictions. Engaging community was difficult because participating in workshops is at the bottom of their list of priorities, especially when they have to figure out where they're going to sleep that day. Measuring the true outcome of the intervention was difficult due to the time constraints. Finding motivating factors for participants to modify lifestyle behavior was also challenging, also because it is at the bottom of their list of priorities when they barely have food to eat. This is the end of my presentation. Thank you for taking the time to watch my presentation. The next slide provides the list of references that I use for my information. Thank you.